My name is Ben Shogan. I'm a colorectal surgeon at the University of Chicago, and an assistant professor of surgery. As many of you know, it was kind of alluded to here, about 2 million people every year get diagnosed with colon or rectal cancer worldwide. You probably have friends or family that have been affected with that. As you also may know, surgery is the #1 treatment, and in some patients, they can be completely cured from their colon or rectal surgery. But unfortunately, up to about 50% of patients will get their cancer back even after surgery. It's really frustrating. We'll do a great operation, they do fine for a couple months, and a year or two later, their surgery comes back, or their cancer comes back, and we really don't know why that's happening. And unfortunately, in those patients in which the cancer comes back, most of them, unfortunately, will die from colon or rectal cancer. So like Dr. Rubin said, I'm a surgeon, but I'm also a scientist. I spend half of my time in the lab trying to figure out why is it exactly that this cancer can come back after you do a surgery in which we remove every cancer cell that we know of. We've developed an interesting model where we do the same surgery we do in humans, but we do it now in mice and in rats and replicate exactly what we do in humans. We've recruited patients who have real colorectal cancer, my own patients, Dr. Hyman's patients of the whole GI group, and they're sending us their stool. We give them a little box in clinic, they go home, they poop in a little bag, they send it to us. I know it's gross, I'm a colorectal surgeon. But what we found is, interestingly, is that the bacteria that is colonizing these patients around the time of surgery, we think is having a direct role in having that cancer come back months or years later. And what we're trying to do now is figure out ways in which we can change those bacteria, either through diet or antibiotics or other methods, to have that bacteria really not work against us, maybe even protect us from that cancer coming back. And that's what my work is focused on right now. Like Dr. Rubin said, GIRF has been funding me now for the last 2 years. Sincerely grateful for all of you, and very honored to be here. Thank you very much.